Okay, we're starting. Hi, this is John Bennett from Miami and InternetMedicine.com. Tonight, I'm doing an informal interview. We arranged it today, matter of fact. That's how informal it is. With Ryan Kurakosi of Pilltalk.com, a new application which Ryan will tell you about. He also works for Omnicell, a big pharmacy information company. I'll let Ryan run the show. He's going to talk about it and maybe show you a few screens to see what's going on with his application. And okay, Ryan, welcome to the show.
Hey, thanks, Dr. Bennett. How you doing?
That's a good sound effect.
How are you doing?
Very good, very good.
Yeah, I just want to take a few minutes to talk to you about Pilltalk, an application we just recently launched. The goal of the application is really to simplify patient counseling for healthcare providers. If you want, I can just walk you through that really quick, and then if you have any questions on the application, just feel free to just let me know as it goes along. So here I'm just opening up Pilltalk. This is a fairly new version that we've just launched, and it's both on the Apple iTunes Store as well as the Google Play Store for Android devices. Just recently launched this new version. It's a very clean interface. And like I said, Pilltalk's really, the goal is to simplify patient counseling. Here I'm going to search for a medication, and let's just say I'm looking for a drug like Lipitor, and I'm a healthcare provider, pharmacist in maybe a community pharmacy setting. So really what the goal of it is to sort of combat some quote-unquote data fatigue and really help healthcare providers, pharmacists, pharmacy interns to counsel their patients in a timely manner, and especially in a busy pharmacy environment. So here you can see that they can get their administration, when they should be taking the medication, specific food that they should be watching out for if they're pregnant, not to use this kind of medication. So it's really high level. If pharmacists do want more information, they can always directly put it on the feedback portal. Then that's a dynamic portal which comes to us directly, and our medical information team can actually respond to them, or they can use a standard medication database source as well. Can you tell me more? So we can always follow up with them and let them know if they had any more questions. They can also put personal notes, remind patients to avoid great food use. Right, so you can put your personal notes in there as well. Very easy to use interface, personal notes, and they have your feedback, like I said, and they can also favorite certain drugs that they feel like they come across all the time. Not only is that, there's also, a lot of new drugs are coming on the market. People are always looking for different types of drug feedback. So here you see that don't see it, ask us. They can actually any kind of informal question that they might have as well.
Okay.
So yep.
Okay, you want to talk about it a little bit?
Yeah, so that's pretty much an overview of the application. We've had a good amount of feedback from pharmacists and nurses alike on the application to date. So I think it's able to combat a lot of this common issue that people are having with too much information in the marketplace right now.
Yeah, there is. It's almost like you have to be a curator. It's the same in any field. I know it's in medicine that there's so much information. You've got to be an editor, constant editor. That's weeding out the good stuff from the bad.
Yep.
But I have a question, Ryan.
Yep.
Now I'm sure with anything you got to be careful with information that you give out. I'm sure you have disclaimers about how patients shouldn't take the information they have that you give them to diagnose or to treat their problems, right?
Yep. Most of this is actually directly targeted to healthcare providers, and they can actually use it as a secondary resource to their own information training and their own knowledge base. So this is really a secondary source, and drug information is always changing, so healthcare providers should always look at a secondary source as well. But we do constantly look through the application to make sure we monitor and also take direct feedback from customers and healthcare providers.
Well, you take feedback on the app?
We take the feedback directly on the application itself, so they can actually submit, say, hey, can you double check this? hey, this is great. Can you add more information along these lines? And we can always directly take that feedback and update it dynamically.
That's a nice feature.
Thank you.
That's a nice feature for any website even.
Yep.
To be able to have people to talk about. And I think that's, I alluded to that when I was talking to you before, was that I think that's why a Hangout, it's almost, it sounds like that app is almost like a mini Hangout for pills, essentially. You know, people come to it and talk about it and give you feedback, and they're, you know, you're doing exactly what I'm trying to do with the website. You're engaging people, and that feature will engage the person and make them feel like they're being a part of the, you know, developing that drug and making it better, so that there's less problems for people in situations in future, you know, future situations.
And I think that's really the goal behind Pilltalk. Is really the philosophy is counseling patients, communicating with people, and really getting that interaction going with amongst not only healthcare providers but healthcare providers and patients. So I think, you know, we wanted to make sure that the user interface and the way people interact with the app sort of goes in line with our philosophy, which is really communication and being open. And we really want to try to build a dynamic portal where people can actually share best practices, share the counseling points that they believe is, you know, the strongest points, and, you know, really continue to grow the knowledge base that we're sharing as healthcare providers.
Well, how do I guess right now, where do health care workers go for the information before your application? Do they go to Medscape, or where do they go for drug information?
They can go to Medscape. They can go directly to Lexicon, Micromedics, Hippocrates is a famous one. But you know, those are great references, great reference sources for healthcare providers. But, you know, from what we've heard and even from our own experience, it's just sort of difficult to manage to find the right kind of counseling points when you need it directly. So the great thing with Pilltalk is that we're actually giving high-level information in terms of what kind of counseling points you can have. So you can always find this kind of information, but it just takes a lot longer, and in a busy kind of environment where when you have 3 seconds or 4 seconds to talk to people, it doesn't really work. So what we want to do is provide it to people in like 30 seconds or less.
Yeah, I don't think, do they have feedback? I don't think they do they? The Medscape and the
outside of a general contact information like an email, I haven't really seen anything. But not, you know, ours is directly related to the drug itself, and also have an open portal for any kind of inquiries.
The feedback, is it for every single drug, or just generally for the website, or?
For both. Every drug will take feedback on it, and we'll reply back to the users directly. So
Yeah,
we have a medical information team of pharmacists actually, you know, vetting that information and looking for the stuff.
So a patient can see other people's feedback.
Right now, you can't see other people's feedback, but what we do is we sort of take everyone's feedback. We look at different sources of drug information, make sure that we can validate that information, and if it's something that we seem to think that it will actually provide positive counseling points, we actually put that back into the application. But
go ahead.
But we do actually make sure that we do look through everything and let people know that, you know, why or why not it was approved.
Well, that's why sometimes I tell people the value of patient groups, like Patient Like Us. I don't know. Are you familiar with that website?
No, I haven't heard about it yet.
That's the kind of website where, for example, they have a group for Parkinsonism patients. That they kind of have a group, and they exchange information, and they chat back and forth, and I think they probably have educational meetings. But that's what I tell some people, the value of groups like that is they can kind of compare experiences. Like maybe that would apply to drugs too. People say, "Oh yeah, I tried this medicine, and it really helped me." Do you get that kind of feedback? Is that?
Yeah, we get lots of types of different types of feedback from customers and healthcare providers, letting us know their experiences with the different medications.
In one instance, I was talking about it's a heart problem called atrial fibrillation, and I knew someone that had it. I encourage them, go to a patient group where you can compare notes with people that were in similar situations, and that were helped in some cases. And people in these groups, maybe it's the same with your feedback with drugs. is that they'll say, well, I tried this drug, but I tried another drug and it worked a little better. Do you get kind of that type of feedback too?
Most of it is really just, hey, can we, look at, more information to be presented in here, or maybe there's something that they think that's not necessary to be counseled on. So it's really all focused on counseling. But we have seen a few sporadic comments and from users saying, hey, trying to just create a community of different experiences with their drugs.
Okay. So, and I think you may have mentioned it, 8,000 downloads.
Yeah, I think almost 8,500 downloads to date, and that's on the iOS market, the iTunes market, and we just recently launched into the Android market.
That's pretty impressive figures, correct?
Yeah, and we're actually looking forward to increasing those numbers over the next coming months and the years.
What are the future plans? Any immediate future? Like you mentioned something about you doing a demo for the website.
Yep. Really just the major thing is just getting word of mouth out there right now, because we've heard from a lot of different people and a lot of different pharmacy and nursing students that this app is really helpful for them and that they were actually able to talk to their patients. So really just getting the word out there. The first part of the development process was getting the application developed as well as creating the database. Now it's really all about marketing and getting word of mouth out there to a lot of potential users.
Okay, very good, Ryan. Thank you very much for taking your time, and I'll just sign off here, and I'll talk to you after I stop.
Thanks, Dr. Bennett.
Okay, hold on.